So I'm going to review the patient's chart, medical history. I'm going to come in, wash my hands, provide privacy. Hi, my name is Jacob. I'm going to be a student nurse today. Can I get your name?
Timofey Volkov.
Date of birth?
2590.
Okay, can I see your wristband to verify? Okay, good. All right, Timothy, we're going to be doing a head and toe assessment on you today. Is that okay?
That is.
All right. Just going to ask you some questions first. Can you tell me, from a scale of 0 to 10, where's your pain at?
0.
Okay. Can you tell me where you're at right now?
Doctor's office.
Can you tell me why you are here?
Checkup.
Can you tell me what the date is today?
12/15/20.
Yep. Can you tell me who the president is currently?
Donald Trump.
Yep. Okay, so we're going to start with your vital signs. And so we're going to get the thermometer, check his temperature. We're going to put this on, turn on, put this under his tongue, and he's going to take it out when it starts, or I'll take it out when the thermometer starts beeping, and it should be at 98.6 degrees Fahrenheit, which is normal. Then now we're going to measure your radial pulse. So can you give me one of your arms? Okay. We're going to measure this for 30 seconds. Okay. Respiration rate is at 16, and radial pulse rate is at 70, so everything's good there. And we are going to check your blood pressure. We're going to find your brachial artery. Okay. Is that tight enough?
Yep.
Hold this really quick. Okay. Blood pressure is 120/80, so that's good. Okay. Now we're going to go to his head. We're just going to palpate his hair. Make sure there's no lesions, no lice. Make sure the hair texture is good. Make sure there's no balding. Everything's good there. We're going to palpate his ears. Okay, there's no inflammation, no lumps, so it's good there. And we're going to check his pupils. Make sure they constrict and dilate. Just look straight ahead. Okay, pupils constrict and dilate properly. And then I'm going to observe his sclera. It's white, moist, no jaundice. I'm going to check his conjunctiva. It's pink, moist, no lesions. And then I'm going to check cranial nerve number 7 is facial nerve. So can you close your eyes really tight, open them, smile, frown, puff your cheeks. Okay, good. I'm just going to apply some pressure on your jaw. You're just going to open it. Okay, great. And now we're going to palpate his lymph nodes. Okay, no inflammation, no bulging in his lymph nodes. And now we're going to be checking his mouth. Gums are pink, no cracks, no dryness. And now can you open your mouth? Okay, looks like his tongue and his gums are pink, moist. They're not dry, there's no lesions. His teeth are white, no cracks, no missing teeth. His tonsils are also pink, moist, no lesions. Uvula rises up, no lesions, and it's moist, pink. And so I'm going to be checking your gag reflex, which is going to be your glossopharyngeal cranial nerve number 9. So you're going to open your mouth again. I'm going to get my tongue blade, put on the tongue, touch the uvula, make sure he gags. So that would mean cranial nerve number 9 is intact. And his vagus nerve, cranial nerve number 10 is intact, no hoarseness, no slurred speech. And now I want you, for cranial nerve number 12, hypoglossal, I want you to stick your tongue up, move it side to side. Okay, number 12 is intact. And for the accessory nerve, number 11, just move your head side to side like this, up and down. And then I'm going to put pressure on your shoulders. You're just going to shrug them. Okay, good. Number 11 is intact. And then we'll palpate his temporomandible, open your jaw. Okay, everything's good there. And now we're going to move on to his chest, and his overall skin pigmentation is appropriate for ethnicity, no lesions noted anywhere. And so now, Timothy, just go ahead and stand up for me. Do your measure the diameter of your chest. Okay, is 1 and 2 in diameter. Sit back down. We're going to do symmetric chest expansion. Deep breath. Okay. Deep breath. Okay, good. Now I'm going to palpate your lungs, and you're just going to be saying 99 every time I put my hand on your chest.
99, 99, 99, 99, 99, 99, 99, 99.
All right, you're back.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now we're going to auscultate your lungs. And you'll just be taking some breaths for me while I auscultate. Okay, and to your back. Okay, lung sounds are clear bilaterally, no crackles or wheezing noted, no difficulty breathing. And so now we're going to be moving on to his heart. We're going to palpate his pericardium. Okay, good. Now we're going to be listening to his heart sounds. Aortic, tricuspid, Herbst point, aortic, pulmonic, Herbst point, tricuspid, mitral. We'll do the same thing with the bell, same places. Apical pulse right here. Okay, heart sounds are good, no abnormalities, no heart murmurs. So that's good, and now we will look at your arms. You can stick your arms out. Skin color is good, no lesions noted on the arms. Check the skin trigger. Okay, that's good. And then I'll be checking the capillary refills on his fingers. Make sure there's no clubbing. Everything's good there. Put your arms down. Now we're going to be checking your abdomen, so you can go ahead and lay down, put your head that way. So now I'm going to auscultate his all four quadrants in his abdomen. Okay. Bowel sounds are present, all four quadrants, no hypoactivity, no hyperactivity. Now we're going to do light palpation on all four quadrants. Now deep palpation. Okay, good. No inflammation, no bulging. Then I'm going to do percussion. Okay, no abnormalities noted. Dullness was heard at the upper quadrants, so that's good. And now we're going to palpate his vascular sounds, so aortic, then his renal, then iliac, okay. Then I would do this femoral, which is right here on the groinal area, do both sides. So good, everything's good there. All right, you can sit back up. And then now I'm going to test your patellar reflex. Get your leg up a little bit. Just gonna whack it. Okay. Everything's good there. Go ahead, stand up. And you can just walk around a little bit. Just gonna check your mobility and your gait. Okay, good. I'm just going to be looking at his legs, make sure there's no lesions, anything like that. I'm checking for any edema in his legs, feet. Go ahead and sit back down. And also check his feet, under his feet, check his heels for cracks, lesions. Now do capillary refill on his toes. Make sure that's all good. And then also, can you just lay back down really quick for me, Tim? I would assess his genitals, and also make sure he's not laying in any tubes or lines. Make sure his genitals, or make sure that there's not a urine catheter in his penis. Make sure there's no discharge, no redness anywhere. Check his urine, make sure it's clear, normal color, no blood in it. And then I'll also palpate his penis and scrotum and just check for lesions or bulging, lumps, any other abnormalities. Okay, Timothy, do you have any other questions?
No, that's all.
All right, good.